Ryan McWilliams is here with BSF Pitcher Performance at Bo Jackson's Elite Sports Domes. Today we're going to be talking about a concept of elbow pain, or known as golfer's elbow. So this is a typical, injury that happens in baseball, specifically more for pitchers, but it does happen to, positional players as well. So we're going to cover this topic. We're going to dive a little bit deep into the anatomy and some of the misconceptions you usually see when we're taking care of, athletes. When we're looking at the elbow and the anatomy of the elbow, all right, we have to understand really what is golfer's elbow and what is the reason why, what's the reason why we have elbow pain as throwers. So I'm gonna dive a little bit deep into the concept of throwing. So I'm here with John Rings, athlete here. He started with us at 80, 85, dropped out of college to pursue life insurance as an agent, right? Yeah. And as a manager, and he wanted to get back into the training. He came here 2 months later. He's sitting 89, hit 90 miles an hour with us. And now we're going to get him back up to that next level and keep pursuing his college career. But I'm using John as an example without the elbow. So when we're looking at throwers, okay, one of the things we have to take in consideration is when we hit front foot strike, all right, this is a very important concept. When we hit front foot strike, right, this arm goes into a passive range of motion. Passive meaning we cannot control layback, all right? This is active, so John, go through your active. That's his active external, but when you watch any major league, little league, college thrower, or even high school thrower, when they hit front foot strike, you're gonna notice that this forearm is gonna be parallel all the way to the ground. And so because that's passive, you're relying heavily on structure and specifically tissue quality, muscle tendon units, and the muscle fibers that are contracting to stabilize that end range where peak stress now happens at this elbow, okay? So when we're looking at the screen here, right, we have to understand that the elbow is a hinge joint, meaning flexion and extension. So from an anatomy standpoint, right, the elbow was never meant to go passive this way, right? It's only meant for flexion and extension. So now we have to look deeper into, well, what particularly is getting injured into the elbow, and that's the UCL, the ulnar collateral ligament. And the medial epicondyle is predicated on the ulna bone and the humerus bone, right, of the arm. So the humerus also attaches into the shoulder socket, okay, the glenohumeral head. So one, you got a ball and socket joint dictating a hinge joint. And that's a very important concept for us to understand. So stay with me here. So when you're looking at the elbow, it's formed by the ulna and the humerus. And because of that, we have to understand that all the forearm flexor muscles, they attach onto the lateral cross section on the humerus. So when we have elbow pain, the first thing that's going to start to tighten up are our forearm muscles. But usually diagnosis and treatment is we always look from here down, right? We're just treating the symptom, not really looking at the cause. So usually with like golfer's elbow, a lot of it is rotational torque happening here in this medial epicondyle. And so a lot of it is predicated on the static position of the shoulder. And usually when you see athletes who have golfer's elbow or elbow pain are usually more dominant into a static internal rotated position of the shoulder, which throws the displacement off of the humerus relative towards the ulna. And that's very, very important for us to understand and realize that when you have a misplacement of the humerus bone, it creates more rotational torque happening here. So one, the athlete's gonna be more preset into internal rotation. So now think about it as a thrower. When throwers go to separate, they would have to supinate this wrist more to get flipped up into horizontal abduction. So now you're placing more rotational torque in the act of throwing to get this arm to the late cocking stage where stress also happens. So they have to supinate and rotate more through the elbow, and then they hit passive. So you're kind of doubling up on, you're doubling up more on stress. And so for us, we have to look at, okay, so if we know that a ball and socket joint is dictating a hinge joint, now we have to look at the function of the shoulder. And so how the shoulder now functions overhead is going to come from the scapula. So the scapula is a floating bone on top of the rib cage, and how it's placed on the rib cage is going to play a huge role into the function of overhead movements, okay? So when we're looking at the scapula, there's a concept known as scapular humeral rhythm. So now the muscles that control that, right, one of the biggest ones that we have to look at is the serratus anterior muscle. That's going to control upward rotation and protraction of the arm. So that's why we have to look when we have elbow pain, right? We can't just look at what's tightening up. That's the symptom, okay? So tightness is a neurological response that says, hey, I'm tightening up to stabilize for something unstable. And especially when we have that golfer's elbow, that rotational torque happening, you got to look at the placement of the humerus, because again, the medial epicondyle is formed by the humerus and the ulna, right? And so because of that, right, we need to understand from a biomechanical standpoint what is dictating what function. Okay, so again, elbow is a hinge joint, flexion and extension. It was never meant to go passively into external rotation. That's why the whole entire kinetic chain plays a huge role into one, how do we utilize our body, but how do we take less stress off more vulnerable positions on our body, shoulder and the elbow for overhead throwing athletes. So now that we're looking at this whole complexity, right, that's why the shoulder plays a huge role, right? The ball and socket joint dictates this hinge joint. It plays a huge role in understanding how do we treat the cause, not the symptom. And so that's why when we're looking at golfer's elbow, right, there's a lot more to it than just, you know, forearm tightness, right? Usually you'll see a lot of guys more preset, like I said, dominant into that internal rotated position where even they'll get some tightness up here in the front part. But again, we have to learn that the shoulder is also comprised of that rotator cuff. So the rotator cuff is going to be comprised of 4 different muscles. So you got the infraspinatus, supraspinatus, subscapularis, and the teres minor that makes up the whole rotator cuff. And each individual muscle of that rotator cuff is going to play a certain function in how the shoulder moves. And then again, along with the scapula and how that scapular humeral rhythm is controlling upward rotation to the arm. So hopefully that helps a little bit about golfer's elbow and the reason why some guys get that, and to how to not only just treat the symptom, but look at the cause as to why some athletes develop golfer's elbow as overhead throwing athletes.